As I mentioned, it was a Democrats-only meeting as they were exploring a compromise proposal that would empower the Office of Personnel Management, which oversees federal government workers' insurance, to now manage a broader national health care program, kind of in place of the public option. And that's got the folks on the other side of the aisle asking, hey, what about us? What about our input? Let's kick off Happy Hour with Republican Senator Michael Crapo from Idaho joining us to discuss this. Thank you very much, Senator, first of all, for joining us. What is your reaction to now this alternate proposal that was floated around this weekend with the Office of Personnel Management, which oversees your insurance coverage, to oversee the public option version that's being bandied about?
Well, first of all, it's really not developed very well, and we don't know the details of what's being proposed. What we do know is this appears to be just another area or effort to dress up the public option. The question here isn't who should manage it, whether it should be the Office of Personnel or CMS or which government agency should manage it. The question is whether we should have the United States government create an insurance company and move into yet one more part of the economy. We've already seen takeover in the auto industry, in the financial sector, in the insurance sector, in the mortgage sector, and now this proposal for what could be 1/6 of our entire economy. The issue here is government control and whether we should truly focus on the kinds of things that let the private sector work rather than having the government step in.
Senator, you mentioned the private sector versus public, but you know, it's part of what I think a lot of Americans are confused about when we look at the Republicans versus the Democrats, and either one when they're trying to put together a reform, because $1.5 trillion of the $2.5 trillion spent on health care every year is spent by the government, whether it's Republicans or Democrats in power. They both have been moving that number higher as a percentage and overall for decades. What is it going to be from the Republicans that might possibly, I don't know, turn that tide?
Well, the two programs you're talking about there are Medicare and Medicaid, and Republicans have been fighting for years to reform them. In fact, one of the major reforms that we have been able to get into Medicare is called Medicare Advantage, which allows the private sector to start delivering some of the Medicare services. It's the most popular part of the Medicare program today. 1 in 4 Medicare recipients participate in this program. It's growing more rapid than any other part of the program. It's the Medicare Advantage part of Medicare that's targeted by these so-called reforms. And so you're right, there is a major entitlement system in America today. But those of us who believe we should let the private sector work have been trying to find reforms that will let us get back to that kind of health care service.
And Senator, one of those reforms that your party has been talking about is being able to import drugs from Canada and other countries, so that will help competition, free market competition, private competition, and allow prescription drugs to be cheaper for Americans. A lot of Americans go to Canada or to Mexico to buy their prescription drugs. This is something that now the Democrats are warming up to, apparently. They talked about it over the weekend. Is that a good sign? And why aren't you guys there as well at the table?
Well, first of all, whether it's reimportation of drugs or whether it's allowing us to sell insurance across state lines or to expand insurance through pools, through small business expansion opportunities, or trying to refocus incentives on outcomes rather than on procedures, there are a lot of ideas that can let the marketplace work better. Your question, though, was why are not the Republicans at the table? And it's a very good question. There has been very little negotiation. It's either you do it our way or it's not bipartisan.
Senator,
and ultimately, I hope that, yes.
No, go ahead, finish that thought.
I was just going to say, ultimately, I hope that one way or the other, the president and his party here in Congress will recognize that true bipartisan reform is possible in a way that can reduce health care and not have a government takeover of that part of the economy.
All right, and Senator, we're just about out of time, but as you mentioned, you know, you want that the private market in there, the free market in there, but I come back to the government's still allocating that money, $1.5 trillion a year coming through Medicare and Medicaid, whether you reform it and make it pointed towards, I don't know, the Republicans, Democrats' favorite insurance companies or not, it's still coming through the government. It's still not a free market. Can you address that?
Well, yes, and as I mentioned before, what you have there are two major entitlement programs that have been established for decades, Medicare and Medicaid. They are driving huge parts of health care spending in America, and that is government controlled. No question about that. Many of us, as I said, though, are working to try to reform that. It's not something that you can do overnight. But Medicare Advantage was one of those good opportunities that I told you about that could have done it. Now we're starting to see that reform dismantled. It's a matter of whether we're going to move toward market-oriented solutions or move toward greater government control in the economy.
All right, Senator Michael Crapo, thank you very much.
Thank you.